Today, I want to highlight a significant finding in rotator cuff repair. Rotator cuff tears are a common cause of shoulder pain and dysfunction, and while surgery is often successful, re-tear rates can be quite high, ranging from 10 to 75%. However, a recent randomized controlled trial, extended to a 2-year follow-up, provides compelling evidence for a promising solution: augmentation with a bovine bioinductive collagen implant, also known as Regeneten. This study found that adding the Regeneten implant to a posterosuperior cuff repair significantly reduces the re-tear rate. Specifically, at 2 years, the re-tear rate in the group treated with the implant was only 12.3%, compared to 35.1% in the control group. That's a dramatic threefold reduction in re-tears. While the study showed similar overall clinical outcomes between the augmented and non-augmented groups at 2 years, a crucial post-hoc analysis revealed that patients with healed tendons had significantly better clinical outcomes, including improved constant Merle and ASES scores and reduced pain levels, compared to those with failed repairs. This suggests that while the direct clinical benefit might not be immediately apparent across the entire group, the implant's ability to promote healing and reduce re-tears ultimately leads to better long-term functional outcomes for patients. The Regeneten implant appears to be a valuable tool in improving the structural integrity of rotator cuff repairs and, consequently, the long-term well-being of patients.